I am Sebnem Korur Fincanci, a forensic physician and professor of medicine. For decades, I have worked at the intersection of medicine and human rights, particularly in the documentation of torture and ill treatment. My professional work includes developing protocols, particularly the guidelines for my colleagues to work together according to the standard ways of documentation, and also training doctors in documenting any kind of abuse, violations, and of course serving as an expert witness. Along with this, I have been a human rights activist because I just believe that medicine must stand for truth and dignity for human beings. It is very important to have some gold standards while we practice medicine. And documentation of human rights violations is not an excerpt from this situation. And also these kind of gold standards protect us. It's a protective shield against the governments, because when we follow the standards, then we say that we have the gold standards for our practice, so we can't go beyond these standards and tell a different story while we try and exercise the fact-finding missions. So it was protective for us when we started to document a torture case and just used the Minnesota protocol, an autopsy protocol for torture victims. And then we considered that it would be good to have a gold standard for living torture survivors to document their findings of torture so that the physician or human rights activist or a lawyer, whenever they reveal the truth about the alleged torture, then they would have a protective shield as a guideline. So we started working together with CHR, particularly, Physician for Human Rights. So we started on this guideline, and it was a multidisciplinary work with the legal professionals and health professionals and human rights activists, as well as the ethicists, the medical ethics, the legal ethics, and all of these included in Istanbul Protocol. And it was for the first time that we considered the psychiatric evaluation, the psychological evaluation, as a prominent evidence for alleged torture. Because beforehand, the psychological evidence was not considered as evidence, but mostly circumstantial evidence. Though afterwards, we started to use the psychological evidence as a concrete evidence for alleged torture. So it was very important. And also, we knew that many of these torture survivors were not able to have access to physicians or proper lawyers, but only sometimes human rights activists to hear their voices. So it was important for human rights activists also that could exercise some of the facts to be just documented in their archives. So we had the steps of documentation for all professions and lay people as well. For example, taking pictures was very important for such kind of cases. And sometimes taking pictures in a correct way would also help the physicians get involved in the injuries that they could just see on the photographs and the documentation, and then they have the interpretation and the conclusion for such kind of cases, even if they didn't themselves examine the survivor. So Istanbul Protocol was for everyone, for everyday use. It's a daily practice, and it was widely known and used nowadays after 26 years now.